Hi, I'm Dr. Christine McCormick in the PA program here with Professor Michelle Fischer, and it's Tech Tuesday. So in the PA program here, we have a lab that is designed for ultrasound, and our ultrasound curriculum is just an exposure to some of the things that the students might see out in clinical rotations and ultimately in clinical practice. So the two kind of exams that the students have exposure to are the FAST exam, which is typically used in the emergency setting in a trauma situation, as well as the more superficial exam, which you would use this kind of ultrasound for, which I'm going to demonstrate in a second. And this would be typically for vascular access, so in a patient who you might need to place an IV line in for fluids or medication delivery that maybe the nurses couldn't get an IV in with just a blind stick. So what I'm doing here is I'm taking the probe and I've put some of the conducting gel on here as well as a tourniquet to kind of make the vasculature pop up a little bit. And then you're going to place this on the patient and you're going to scan back and forth, and I'm looking to find a vein where I could theoretically stick this patient with a needle and then introduce an IV catheter that would then stay in the patient's arm and deliver medication or fluids or whatever that patient might need. There's a couple different ways that we can do this. We can do it in the orientation in which I'm currently holding it. And then once you find the vessel that you want to look at, some people actually prefer to change the orientation of the probe so that they can more directly place that needle into the vessel of their choice. Ideally, this is a two-handed procedure because you're going to need one hand for the probe and then the other hand to introduce the needle and the catheter. And hopefully you're going to have an assistant with you, a nurse, a tech, a student, somebody who can kind of help feed you the materials that you're going to need to make this be successful, ideally in one attempt to cause the patient minimal discomfort.